Hello again, everyone. This is Mr. Saiter, instructor at Dublin Soda High School, and we're going to be talking about the humerus and forearm today. This will be your flashcard type video to review with. All right, let's go ahead and start. The two bones we're going to look at, or three bones I should say, are the humerus. So we have an anterior and posterior view of that here, and the radius and ulna shown on the right side of the slides. So the first half of this show will be just doing the humerus. This green arrow points to a large bump up here called the greater tubercle. That's a site of muscle attachment, so greater tubercle. All right, this next one here, small little bump here, what is this called? Another muscle attachment site. That is the lesser tubercle. This one's a little bit hard to see. You almost have to feel it with your hands, but you can kind of see a little angle right there. Another muscle attachment. This is the deltoid tuberosity. This is where your deltoid muscle attaches to. All right, this next one is a small cavity here on the bottom of the bone, or the distal end of the bone. It's just above this ball shape here. That is the radial fossa. All right, over here we have another depression, another fossa. That's a clue for you. It's the coronoid fossa. This depression allows your elbow to fully flex. All right, this ball shape right here. Think of it as Charlie Brown's head. That's the capitulum. This word means head, so think of words like capital, decapitate, and that might be a way to help you remember that. All right, next we have both. We're going to see this on both views. This ball, smooth ball shaped up here. That is the head of the humerus. Forms a joint with your scapula inside the glenoid fossa. All right, just below that we have sort of a it's where the end of the head is. It's sort of the border of that smooth head. This is called the anatomical neck. It's called this because it fractures there quite a bit. All right, this one's kind of hard to see, but there is a line that kind of goes down the back of the humerus there. It's called the radial groove. There's a nerve that goes right on top of that called the radial nerve. All right, this one right here, this is a notch between these two greater and lesser tubercles. And it's called the Intertubical sulcus. So just think of tubercle, intertubercle between two tubercles. And a sulcus is a groove. All right, down here on the edge where the bone kind of flares out at the bottoms, those are the medial epicondyles. All right, this next one here, it kind of looks like an hourglass, but the word this bone is named after means pulley in Latin. This is the trochlea. Kind of looks like a pulley or an hourglass. Okay, on the back, there's a big depression above the trochlea. So that depression is going to be called what? That is the Olecranon fossa. That allows the Olecranon process in your ulna to fully extend your forearm. So bone on your ulna dips into that. All right. These bottom of the bones that flare out, those edges that widen there, those are the lateral epicondyles. Okay, that is the end of the humerus. If you want to go back and do it again, this is the time to do that. We're going to go ahead and move on to your forearm. Let's just start with the name of the bone. What is the name of that bone there? That's the radius. I'm going to go back for a second. If you look at the top of the radius, it's got a very round structure on the end. And I was thinking, well, it's round. Things that are round have a radius. So it's almost perfectly round, so maybe that'll help you remember it. All right, what is this next bone here? It's on the medial side of your forearm. The radius is on the lateral side of your, I'm sorry, the radius is on the lateral side. The ulna is on the medial side. All right, what is this bone? This is the ulna. If you look at the end of the ulna up here where the trochlear notch is, you can kind of see it looks like a U, and ulna starts with U, so that might help you out a little bit. All right, that round thing, that is called the what? We just talked about. That is called the head of the radius, if you want to be specific. All right, just below the head we have, and a clue would be what's just below your head. That is the neck of the radius. All right, this arrow is actually in the wrong place, so I apologize for that. But just below the neck, there's sort of a bump that sticks out right in the area just below the neck. It's kind of in this illustration, it's kind of a lighter shade. That's the radial tuberosity. I'm going to have to go back and change that. This arrow is just pointing to the radius itself, but that's the radial tuberosity. Sorry about that, guys. Just below the neck, not where the arrow is pointing. Radial tuberosity. All right, all the way on the bottom of the radius, there's a slight raised area that sticks out. That is the styloid process of the radius. There's also one of those on the ulna that sticks out. You can kind of see it a little bit better in the illustration. This kind of brackets your carpal bones of your wrist. That is a styloid process of the ulna. So you've got one on the ulna, one on the radius. The one on the ulna is easier to see. All right, up here at the top, there's an area just lateral of the head of the radius. That little notch there is called the Coronoid process. All right, up here at the top, we've got this thing that makes the U. That makes a joint with the trochlea. That is the Olecranon process. And finally, the entire notch is called the Trochlear notch. This is what makes the joint with the trochlea again. Okay, let me know if you have any questions or comments in class or in the comments here. I hope this was helpful to you, and you can use these as flashcards.